Are you someone who feels anxious? Watch today's video where I'm going to go through these different anxiety disorders to see if one resonates with you. Hey there, my name is Diana Garcia. I'm a licensed therapist in Florida and owner of a private practice called Nurturing Minds Counseling. If you're new around here, hit that subscribe button to get more tips to nurture your mental health, improve anxiety, improve your relationships, things like that. All right, let's jump into today's video. Okay, so this is actually part of an anxiety series that I'm doing, Decoding Anxiety. You can check out the playlist here. I've done 2 videos so far, so check those out just in case. It might be helpful before we dive into today. What I'm going to go through today is actually this umbrella of anxiety disorders, because I don't think I really have, and you might have some information, but I just really want you to have a better sense when we talk about anxiety, different types of anxiety. So maybe you see if you resonate with one or the other. Okay, so I want to give a little bit of a caveat before I go through these different mental health disorders related to anxiety. Now, when I'm giving psychoeducation to a client about a specific disorder, when going through the symptoms to see if they resonate and I'm doing an assessment, I always want to make sure that I'm saying, I'm glad this is helpful if it's empowering you to feel validated, to feel seen, and then to have a better sense of what you need to tackle. But I don't want you to over-identify with this diagnosis. And this is really, really, really important. Sometimes when we hold on to a label, our mind really gets attached to this label, and that can become a limiting reason, a reason why we can't do something. And there's a difference between validating and holding space for your experience and your difficulties, which I'm all about. And even when I give information on mental health disorders, absolutely. Hopefully that's the purpose. But if then these labels or diagnoses first feel like they box you in and don't really explain your experience, feel invalidating in some way or minimizing in some way, or if they, again, you hold on too closely or over-identify with this mental health diagnosis and make it part of your identity in a way that isn't helpful, right? If you make anything part of our identity in a way that isn't helpful, then you just need to be aware of that. So I want to have that caveat before I jump in. These mental health disorders that I'm going to go through, it's from what we call the DSM, Diagnostic and Statistical Manual of Mental Health Disorders. This is what I and any mental health provider has to use to diagnose someone. So if someone presents and says, I'm struggling with X, Y, and Z, this is kind of the criteria that we have to look at and see, do you meet criteria, these symptoms within a certain time frame? Then yes, you meet criteria for X, Y, and Z. Similarly, if you go to the doctor and you're ruling out any type of medical condition while they're running tests or whatever the reason that you're going, right, they have to code some type of medical reason for the services that are being provided, whether you're using insurance or not. So it's kind of similar, this kind of medical model. To keep in mind, we as humans are multifaceted. So sometimes the argument is made that you can't really box people into these categories or rigid categories. People don't fit into these neat little boxes as much as this manual wants to make it seem. So that's something to keep in mind. I know when I work with individuals that is accurate. Sometimes it's not so clean cut, oh yeah, you meet criteria for this or this, and there's a lot of symptoms that can overlap. There are situational things, factors that are playing a role, cultural factors. There's so many different things that are showing up that it's not just so neat. And I think that's anyone who works in the mental health field has a sense of that and knows that. But I just want you as well as an individual to keep that in mind. So even as I explain these different mental health disorders, if you don't meet one perfectly or something, that's okay. It also doesn't take away your pain or that you should try to seek treatment if you feel like it would be helpful. Now, I also want to back up. I know a lot of mental health providers who don't even use diagnosis. They don't really believe in it. They have some hangups about it and about the medical model in general. They really feel it's limiting. It's not helpful. And that really doesn't do much in terms of guiding treatment outside of having some general information for you or the client. I also know some providers that really talk about moving away from these rigid categories of mental health disorders and really kind of digging deeper into the processes that maintain all these disorders, right? There's certain processes, whether it's an anxiety disorder or an eating disorder, and if we kind of dig away from some of the way it presents on the outside or the symptoms, there's certain processes that we can see are concurrent in most of these disorders. I do work from a model that does kind of follow that a little bit, that regardless of what the mental health disorder is, that there's certain processes across the board that are maintaining this. Now, that doesn't mean that I completely disregard this information or don't share this with clients either. So I tend to be somewhere in the middle. Again, I just want you to know that as I'm jumping into this video about mental health disorders. Okay, so the first disorder I'm going to go through is separation anxiety disorder. So pretty much kind of the core fear here is this fear of being away from your attachment figures, your loved ones, or your home. You can see this both in children and in adults. And so when either the parental figure or partner leaves the home, there's this increase in anxiety, ultimately this fear that something might happen to them. So they might get hurt, an accident, something along those lines. Or if they leave the home, right, if the individual leaves the home, that something might happen to them where they get separated, right? They get kidnapped, they get lost, something along those lines. So then there's this effort to avoid that separation or resistance to be away from this attachment figure or the home. And there's distress, obviously, when they leave. When they leave the home, there's an increase in distress in those moments. Next one is selective mutism. This is most commonly seen in children, although it could manifest in teens and adults. This is when an individual will not speak kind of outside of the home. So let's say a child can speak at home, will speak to mom and dad, maybe even siblings, but when they leave the home, they will not speak in school, they will not initiate social content, they will not talk, or if someone asks them a question, they will not respond. And it's not due to a lack of knowledge or ability. Again, it's this anxiety that's maintaining this fear of speaking. So you would see that again most commonly in children. The next one I'm going to go through is specific phobia. So pretty much it's this intense and marked fear of a specific thing, object, or situation, like a specific stimuli per se. That could be like an animal, right? Dogs, roaches. I hate roaches. It can be a fear of like flying, heights, natural events. It can be a fear of like, blood, needles, right? Medical procedures. It can be a fear of maybe a situation or eating something that will make you vomit. So something along those lines. And it's also helpful to keep in mind that you will do efforts to avoid being around this stimuli, this cue. And some of those efforts can be pretty intense. So you just might not ever fly. And you see that pretty often. Or maybe if you have this fear of highways, you won't go on the highway. You also this fear is out of proportion to the potential danger, right? So if you have this fear of storms, but there's like a hurricane coming and you're in the path of a hurricane, right? It'd be normal to have some fear, but we would say it's out of proportion. And again, that you engage in a lot of avoidance behaviors. The next one I'm going to go through is social anxiety disorder, social phobia. Pretty much this is when there's this fear of being judged by others in a social context. Ultimately, there's this fear that people are going to negatively judge you. Also, this fear that others might know that you're anxious, they can tell. You will do efforts to really avoid social situations, just outright not be involved in social situations. Or if you are in social situations, you really won't engage, or you'll use some type of crutch, right? So I'll say like maybe you drink excessively because you feel like that's the only way you can move through these social interactions without letting your anxiety take over. Like this subtype is performance only. So right, this fear of public speaking. I heard something the other day that said people are more afraid of giving public speeches than of dying. I don't know how valid or true that is, but again, I think it gives context to the fact that public speaking is a pretty common fear, but it falls under this subtype of social anxiety. Okay, the next one I'm going to go through is panic disorder and then panic attacks. So I just want to distinguish because in the DSM, they have panic attack disorder, which pretty much means is that you're having panic attacks. What is a panic attack? It's a moment where you have a surge of intense anxiety and you're having associated physical symptoms, right? So like I mentioned before in my last video, that fight or flight response is kicking in. Here, I've also listed kind of all the symptoms that the DSM kind of has you look out for. A very common one you'll see like this fear of dying or that you're going crazy. That's a pretty common one that I see. With this fear of dying, what I also see is that it really then propels individuals to go to the emergency room or call 911 because they think medically like I'm having a heart attack or something's wrong. I need to make sure, I need to rule out do all the tests to make sure I'm okay. And even when they go to the ER the first time, that doesn't provide like long-term relief. It provides short-term relief, but not long-term relief because the next time you start having a panic attack, you still have that fear. So you think, well, what if they miss something? Well, what if this is different? What if this is new? Now, the difference why the DSM has a panic attack disorder versus a panic attack is that with the disorder, it means that after an individual has one or multiple attacks, it's that then after a month after, they start to engage in avoidance behaviors to make sure that they don't bring on another one, right? So they will avoid situations that they think will bring it on. So if they had one driving, like maybe I shouldn't drive. It happened at work or at school. I can't go to those places. So there's some type of avoidance and an increase in like really being hyper aware or hyper vigilant of any changes in your physical sensations, which ironically can make it worse. Why a panic attack is separate, right? Just a panic attack. It's still that panic attack, but you're not having that associated avoidance after the fact. And it's different to note that a lot of individuals have panic attacks, but they don't develop panic disorder because of that difference, that they're not engaging in that avoidance after the fact. Okay, the next one I'm going to go through is agoraphobia. So this is this fear of 2 out of the 5 that I'm going to go through. The first one is this fear of public transportation, so buses, trains, something like that. The second one is this fear of being somewhere open, a parking lot, a bridge, or the opposite, somewhere enclosed, the mall, the movies. The fourth one is being somewhere where there's either lots of crowds or needing to stand in line. So thinking of like a theme park, a concert, something like that. The fifth one is just this fear of being outside of the home. So you have to have 2 out of the 5. Now, what's also kind of the common theme that we see here, it's this fear of being unable to escape, this fear that help won't be able to access you, especially if you think you're going to have a panic attack, or this fear that you just might do something really embarrassing. You might fall in one of these settings. The characteristic of agoraphobia is that you do some type of avoidance of these events. If it's really related to being outside of the home, you might see that slowly over time, the individual stops leaving their home, or they drastically reduce the number of instances where they're outside of the home, or maybe it's something like they'll only leave their home if they're accompanied with someone else. The next one I'm going to go over is generalized anxiety disorder. Pretty much it's when you have an excessive and persistent worry about one or multiple things in your life. It could be just a couple domains in your life, but whatever those worry categories are, it doesn't just resolve when a particular stressor goes away. So let's say you're worried about an upcoming job interview, but once you have the job interview and you're like, okay, we're done about stressing out about that, you will worry about something else. Something else would show up that you'll have to worry about. I give a common analogy that it's like you have worry slots, right? So you have 3 or 4 worry slots, and once one gets resolved, something just goes right back into a new worry, goes into that slot. You'll also notice that it's difficult to control the worry, and then you might have some of these symptoms: restlessness, irritability, tiredness, sleep difficulty, something like that, because of this persistent worry that shows up. Next one, really quickly, substance-induced anxiety disorder. It's pretty much when you have anxiety due to a reaction to a substance, of being under the influence of a substance or the withdrawal from a substance. So if that's the case, then that's when we say substance-induced anxiety. Another one, anxiety due to another medical condition. That's pretty much when a medical condition is the reason that you're having anxiety, right? That's what we can say physiologically. Your doctor can say, yes, this medical condition can cause anxiety. Something that you'll notice with these anxiety disorders, this commonality, if that there's an element of avoidance or this effort to, change your life, to not be confronted with this feared situation, right? Whatever the stimuli is. So what's important to note that avoidance causes some type of a distress or impairment in your life. Now, I've talked about avoidance a little bit before, but we all engage in avoidance behaviors at times, but it's noting the severity or extent, and again, how much impairment does it cause in your life. So if you have this fear of highways, and that means that you will go out of your way, and a trip that would take you 15 minutes takes you an hour because you will only go local streets, there's some type of impairment there, right? It's causing some type of functional impairment in your life. Functional impairment with all mental health disorders is that there has to be something for us to say, like, this is having an impact in one or multiple areas of your life. And then each mental health disorder also has this time criteria, right? It's different for each one. For anxiety disorders, I would say the most common one is about 6 months. Okay, I know that was a lot of information to take in. I hope that was helpful so that you can start to identify if you resonate with one or multiple, so that you can start just having better insight and figuring out what you can do to intervene. Something to note is I didn't cover these other disorders like OCD, obsessive compulsive disorder, hoarding disorder, illness anxiety disorder, things like that, because they don't actually officially fall under this anxiety disorder umbrella anymore, but there's clearly commonalities. And if there's another disorder that you want me to do more information about, just put it in the comments below and I can add that to make you videos in the future. I encourage you to go check out this video next in the Decoding Anxiety series. And like I always say, I encourage you to continue nurturing your mind, body, and soul, whatever that looks like for you. Thanks.